All right, so pictured here on our first page, we can see the human skeleton in the organized state that it normally would be in from an anterior view and a posterior view. What we can see in the two pictures is that they've kind of got it illustrated with some bones in blue and some of the other bones, what kind of will be more in the arms and legs, and the kind of traditional off-white tannish shaded, color that your bones really are. And that's because there are two divisions to the skeleton. What we'll be focusing in on for this lecture will be the axial skeleton, which make up 80 of the 206 main bones of the body. What we'll move into next week is the appendicular skeleton, which makes up the remaining 126 bones. Now, the wonderful thing is you're not going to have to learn 206 different names, okay? Because a lot of them are in pairs. You don't have a different name for the upper arm on your right side versus the left side. They're both the humerus, okay? And there are a lot of bones that don't really truly have a name. So like in the names, we have like 24 ribs, okay? Each rib doesn't have a specific name, okay? We've got several vertebrae, okay? They have abbreviations. So it's a little misleading when I say that there are 206 main bones of the body, okay? What we actually have are more than 206 bones. Some bones, and we're going to talk a little bit more about this here in a second, don't actually have a name, and they're just like little pieces of bones. In kids, infants, and children, they have more than 206 because some of the bones fuse later in life. But as adults, and it's generally sometime in the 20s to even the late 20s, almost 30, when the solidification of some of those bones takes place, and that's when we're left with the 206 different names. Okay, what we'll, like I said, cover in this lecture is the axial skeleton, and we can describe those as lying around the longitudinal axis. Remember, the longitudinal axis is just kind of an imaginary line that travels straight through the top of our head down through the groin. If you think about that, anything close to that would be of the longitudinal axis, and therefore the axial skeleton. So that includes all the different bones of the skull, the auditory ossicles, 3 tiny little bones inside your ears, in your throat, a singular hyoid bone, all the different ribs, your sternum or breastbone, and then all the bones of your vertebral column. Okay, that's a total number of 80. And then what we'll get into next week are the bones of the appendicular skeleton, which include the bones of your upper and lower limbs. Also go by extremities and appendages. In other words, we're talking arms and legs, plus what we call the girdles. We have one pelvic or hip girdle that attaches our legs to our spinal column, and then your shoulder girdle includes the clavicle and scapula that help attach our arms to our axial skeleton. Total number there is 126, as I've already mentioned. Nice breakdown of the different bones is listed here in table 7.1. I'm not going to ask you to directly know the table. We're going to learn it, and it's not something I'm going to draw specifically from. While we do that, let's talk about the different types of bones that we have based on their kind of structural shape. We've talked a little bit about this already with the first category there, long bones. The third category there, flat bones. We learned about them the other day. But as you can see, there are other categories or types. Okay, there are 5 different types based on shape. We go 1, 2, 3, 4, 5, but there's a 6th. The sutural bones, that's not a shape. It's just named because they're associated with sutures. I'll get to that here in a second. Okay. Long bones are noticeably longer than they are wide, and that they have a shaft with 2 ends. And remember, the shaft goes by the term diaphysis. The 2 bulbousy ends would be the epiphyses. We just talked about those the other day. These are the ones that we'll find more so in the appendicular skeleton, as long as like the femur, which is the longest bone in the body, the tibia, the fibula, the humerus, the ulna, the radius. But it can be as simple as your phalanges as well. What are your phalanges? Fingers and toes. Okay. Although, like the tip of your pinky is a very small, tiny little bone, it is longer than it is wide. Therefore, it's a long bone. Okay. Your short bones are roughly cube shaped and are nearly equal in length and width. Generally have limited motion and merely glide across one another. They consist of spongy bone except at the surface where there's a thin layer of compact bone. That includes your carpals, which would be your wrist bones. There's 8 in each wrist, and most of your tarsals, which would be your ankle bones. Okay, and I say most, there's one that doesn't classify there. Flat bones are generally thin and composed of 2 nearly parallel plates of compact bone tissue, enclosing a layer of spongy bone. Talked about those the other day. I kind of said it's like a sandwich. They're generally broad and thin with a flattened and often curved surface, making them great for protection or increased ability for muscle attachments. They include your sternum, your breastplate, the ribs, and your scapula, which is your shoulder blade. Irregular bones, just really there's no other specific category for them, so we just kind of throw them in this one. So they have complex shapes, cannot be grouped into the other previous categories, and they vary in the amount of spongy and compact bone that they have. Include all the vertebrae, your facial bones, and then your heel bone, which is the calcaneus. Okay. And then sesamoid bones are called sesamoid bones because they're shaped like a sesame seed. In many cases, they're just tiny little pieces of bone. They're found in certain tendons due to considerable friction, tension, and physical stress. This number of sesamoid bones will vary in size and number from person to person, will not always be completely ossified, and typically measure only a few millimeters in diameter. So this is an example where, like I said, we actually have more than 206 bones in the body. There are an exception to the 2 patella bones, which actually do have a name, whereas other sesamoids don't. They're located in your quad femoris tendon, and we commonly call our patellas our kneecaps. Good. Okay. One thing that's kind of crazy about my right kneecap, it never ossified correctly. And that was the knee that I hurt when I was in college. I actually tore a ligament in my knee, but I went to the ER. They did an x-ray, and I could hear the x-ray tech in the other room go, "Oh my God." He thought I shattered my kneecap because you could see little like lines that look like a fracture just because my bones never fused together. I actually knew it beforehand, but sitting there on the x-ray table and hearing the guy in the other room kind of freaked me out a little bit. It had nothing to do with my patella. It was all in the knee, not at all.
I like shattered mine in 7th grade and still looked like the size of a camel. It's disgusting.
Probably didn't feel too well either.
Yeah.
Anyway, function of sesamoid bones is to protect tendons from excess wear and tear. They often change the direction of a pull of a tendon, improving the mechanical advantage at a joint. We'll see just a few of those kind of like in the thumb area, but we really don't talk too much about those. And then sutural bones are small bones found in sutures between certain cranial bones, named by their location, so not their shape. And they also vary greatly in number from person to person. We're going to talk about sutures, but we really won't talk about sutural bones. As far as the image goes, just kind of showing you the shapes, not something I'm worried about you knowing. So we'll just jump ahead and now start to dive in on talking about bones of the skull. Let you guys write out all the blanks so we don't have to do that later. Okay, our skull also goes by the term cranium, consists of 22 total bones grouped into 2 categories. We'll start by going through each of the 8 cranial bones that form the cranial cavity. So these are the ones that cradle and enclose the brain. It includes a singular frontal bone that forms our forehead and a good portion of the roof of our cranial cavity. There are 2 parietal bones. They form a good portion of the rest of the roof of the cranial cavity. On each side are two temporal bones shown there in purple. And then in the back of the skull, you've got an occipital bone, and it actually goes way underneath to help cradle the base of the brain. And then the two other cranial bones are a little bit more complicated. In green here, you can see it helps to form the back of our eye socket, and a little bit of the side of our cranial cavity is the sphenoid bone, and then the ethmoid bone is a singular bone, also contributes a little bit to our eye socket, but also is very involved with our nose. Okay, we'll go through each of those individually. And then the 14 facial bones form the face. They have no role whatsoever with like supporting cradling the brain. It includes two nasal bones, two maxillae, your upper jaws, two zygomatics that are principal cheekbones. Then you also have, like in your nose, two lateral wall bones called inferior nasal conchae, the vomer. The eye socket, you got two tiny little bones called lacrimal bones forming the roof of your mouth. You have the two palatine bones, and then the largest and only movable bone in the entire skull is your lower jaw, known as the mandible. Okay. Now this is just anterior view of the skull, taken directly from your textbook. Also on the right, we have a lateral view showing you a baby skull, and that's going to allow you to see some of these, what we call fontanelles. I talked a little bit about these the other day. Membrane covered spots where bone formation is not yet complete between the cranial bones of a fetus and infant skull. They enable the fetal skull to modify its size and shape so it passes more easily through the birth canal, and that can lead to babies coming out with some pretty wonky looking heads. My sister-in-law, married to my brother, she's very tiny, and she has 3 kids, and the 2 boys, they look like little baby aliens when they were born. They look fine now, but their heads were pretty cone shaped. The other important thing is they allow the brain to go really rapidly during infancy. Obviously, like I mentioned the other day, don't press on those or anything like that, because that's very dangerous. Okay. As far as the 2 pictures here, don't worry about those. Okay. Now, before we start going through bone by bone, I want to talk about a little bit more of the cranial cavity. We have what we call the calvaria or skull cap. So that would be the roof that I mentioned. It forms the roof and the walls of the cranium. Okay. And then the floor of your cranial cavity is what we call the base, or just cranial floor, divided into 3 fossa. Now, this word fossa is one of those terms that was in the table on that previous lecture. It just means an indentation in a bone. And these indentations are very easily shown here in our lateral view, help to cradle the different contours of the brain. Okay, the anterior cranial fossa cradles the frontal lobes, the middle cradles the temporal lobes, and then in the back of the brain is what we call the cerebellum, and that's cradled by what we call the posterior cranial fossa. Okay, pretty easy to tell here in the lateral view because we know the face is anterior, so this makes this anterior, middle, and then posterior. This image is a little more tough to tell. Well, this is looking at the floor. So in other words, like the top of the head's been removed, we've removed the brain, and we're looking down into the bottom of the skull. Okay, easiest thing you can do is find this big hole, and that big hole is called the foramen magnum. Always is where the posterior cranial fossa is, and so you know this is the back, this has to be the front, this is where the anterior cranial fossa is, and then in the middle is the middle cranial fossa. So make sure you can, identify those 3 fossa there and there, especially over here where it's a little bit tougher. All right, like I said, what we're going to do now is go through each of the individual bones and be able to learn where they're at, but also very importantly, we're going to learn about those very important special features that each will have. And if you have coloring pencils, we will be doing some coloring here. If you don't, that's okay. You can just watch. I'm going to color and hopefully make these things a little bit easier to identify. All right. So let's switch over to my document camera here. What I generally do First is I usually just underline with the color that I'm going to go with. So in the case of the frontal bone, I'm going to color it yellow, and then I will color the parietal bones that baby blue. And I'll go and just color them all, get that out of the way, and then we can go through and identify. We've got 4 different images. This first image just is a straight on anterior view looking at the front of the skull. I color really quickly, so sometimes I can watch some of the lines my 5-year-old would yell at me about, but that's okay. Bottom here, we have a medial section where the skull's been cut from front to back, and we're looking at the interior. And then just straight up from above here gives us a nice view. All right. Okay, so that's the frontal bone. I'll go ahead and color the 2 parietal bones. Frontal is the singular bone where we have 2 parietal bones. And as you can see, the parietal bones are very big, make up a very significant amount of the cranial roof. But also, they contribute significantly to the sides, lateral walls of our cranial cavity. Okay, so on the exam, you might see these pictures. Good chance you're going to see several of these images, and all the different things that are labeled there will be removed. You will have to know, to be able to label the parietal bone or the frontal bone. But I'm also going to expect you to know these different things. Okay, I would say of the 20 questions that's over this packet, you can bank on at least 15 of them just being pictures. Okay, so this is going to be a very, very picture heavy section of the test, and same thing will be the case for the next lecture. Okay, I'm not going to really ask you to know like specifically what these different structures are, just be able to identify them. Starting with the glabella, which is the smooth part above the roof of your nose. You can see it's labeled here in our lateral view. Just kind of imagine this is the space kind of right between your eyebrows. It's not labeled over here, but it would obviously be very visible, so I was just drawing an arrow to it. Okay, it's that just smooth spot where if a person has a unibrow, that's where that would be. Okay, now also located in that very same similar area, I'm going to darken them in a little bit, are 2 tiny little holes, each of which is labeled as a supraorbital foramen. They've only labeled one there. Okay, up above, I say foramina, that's plural. This is passageway for nerve, artery, and vein. Okay, we know superior means above, right? Well, supra is just like the shortened version of that. Orbit or orbital always refers to eye socket. So supraorbital literally means above the eyes. Okay, not to be confused with the infraorbital foramen that we'll talk about later in this lecture. Okay. Last structure, and it's really the only reason I include this bottom left image, and I'm going to darken it in, is what we call the frontal sinus. We actually have 2 of them. These are little pockets in our frontal bone. They are lined with mucus and they actually connect with our nasal cavity. You've probably heard of sinuses before, right? Your sinuses are not your nose. They are these little cavities within our different skull bones, and your frontal bone has 2 of them. They're basically just right there in your forehead. Okay, and if you get like a sinus infection, your forehead might hurt. More than likely that infection is in one of the 2 or both of the frontal sinuses. Okay, now the next 2 bones are called the parietal bones, and associated with them are 4 very important what we call sutures. Remember, sutures are the non-movable connections between our cranial bones. We just introduced those on the previous page. Okay, these are the only 4 that have a special name. There are several more, like you can see there's a suture here and here and here. I'm not worried about you knowing any of those, but these 4 I will want you to know. First of which is called the coronal suture. Okay, visible here in our top 2 images. as well as down here. Okay, you could also draw an arrow and label it over here. I'm really, the only reason I included this image was for that frontal sinus, like I said. Okay, this is the divider between the frontal and the two parietals. Okay, now while I'm down here, go ahead and star and highlight the next, what we call the sagittal suture. This one runs from front to back. It runs through that sagittal plane, where its name comes from, and that's what separates the two parietal bones from one another. Okay. Also visible in our bottom image is the lambdoid or lambdoidal suture. Okay, and this is what separates the parietal bones from what we call the occipital. And it's not shown or labeled here, but this is really, in my opinion, where you see it the best. So I'll draw an arrow to it there. Okay. That's the lambdoid or lambdoidal suture. Okay. And then our final suture, also not labeled, so I will draw an arrow to it right here, is the squamous or squamous suture. Okay. And that's what separates the parietals from this bone, letter D, which is your temporal. We've seen that word squamous now another time. We talked about squamous for the shape of cells. I don't really know why they call it squamous. I'm sure there's a reason, but I can't remember off the top of my head. All right, last thing I want to do, and this is actually a kind of set of structures, very subtle, but you can kind of see these lines. There's shared structures between the two different bones we've been talking about here, the two parietals and the frontal. These lines are called temporal lines, and I'll just draw an arrow from there to them. These are going to form an arc across the parietal and frontal bones, providing attachment for large muscles used for chewing. You guys all put your hands on the side of your skull, like, you know, where that temporal region is, bite down. You can feel that muscle that's right there contracting. Okay, that's where it connects. Right up here. It then runs down from there and connects right there on your mandible. Okay, so those are the first 3 of our 8 cranial bones. Moving on. Very complicated bone comes next. There are 2 of these, your temporal bones. Temporal bones form the lower wall and part of the floor of the cranial cavity. And we kind of break it down into 4 parts, each of which has unique features. Let's color it this nice kind of aqua color. Get a nice view. This is just a lateral view zoomed in from the picture that we just talked about. We're just kind of zooming in right here. Okay. Down here, we see that same image as what we just saw on the previous page. Okay. Where we're looking at the interior of the skull from the lateral, or for the medial view, I should say. And then this is just the bottom of the skull. So the head's been taken off the neck. It's flipped sitting upside down. And what's been done is the mandible, which is lower jaw, has been removed. So this is like the roof of the mouth. Okay. This gives us a good view and illustration to show that these 2 bones come very far underneath to help cradle the bottom of the brain. All right, we're going to start with our lateral view here, where we can see the squamous portion forming the temporal region, what we like to call our temple, okay, kind of that soft spot side of our skull. Okay. Probably the most prominent feature I would say of it is this kind of bridge-like structure called the zygomatic process. Okay. This zygomatic process, I hate the way that it's named. I wish it was called the temporal process. Okay, it's called the zygomatic process because this letter J that it connects to is the zygomatic bone. Okay, so the zygomatic process is on the temporal bone. Your zygomatic bone has a temporal process, so they're flip-flop. I don't know why, but that's what it is. Okay, just below that is a very, very important structure, what we call the external auditory meatus, and I darkened it in. This is your ear hole. Okay, the meatus is the hole. Okay, whereas what we'll see later on in this semester, the fancier term for your ear canal is the external auditory canal. Okay, so another term for it could be acoustic instead of auditory. Those mean the same thing. Okay, hanging down from that, this little hook-like structure is called the styloid process. A very important site of muscle attachment, which a lot of these things are. Okay, in fact, there's a muscle that connects to that, and then it runs to our tongue to help move your tongue around, called the styloglossus muscle. Okay, now I'm going to kind of show you something. I'm not going to worry about you identifying it. Okay, but there's a little indentation on that zygomatic process just above the styloid. Okay, where there's a little indentation to match the curvature of this little ball-like structure of the mandible, and that creates what we call the temporomandibular joint, or TMJ for short. This is your jaw joint. Okay, this is what enables you to move your mouth up and down and a little bit side to side. Okay, and your TMJ is once again the only movable joint in the skull. Okay. So those are all structures associated with the squamous part. And I've already kind of started to jump ahead to the tympanic part, a small ring of bone that borders that external acoustic or auditory meatus, opening to our ear canal. Behind that is what we call the mastoid part. Okay, mastoid part has what we call the mastoid process. This little bulge right there, and you can feel that very nicely if you feel right behind your earlobe. You'll feel a bump right there. That's another important muscle attachment site. What we call the sternocleidomastoid muscle attaches there. You can't see it, but there are tiny little pockets inside of that called air cells. Those are like tiny little sinuses. Instead of connecting to your nose, like the frontal sinuses that we just talked about, they connect with the middle ear. Okay. All right, last structures I'm going to talk about are part of the petrous part, and that's why these other two images are here, best seen as part of the cranial floor, and they form a ridge that separates the middle and posterior cranial fossa. Okay, the real reason I included this bottom image is so you can see what's called the internal auditory meatus, which is an internal ear hole. Okay, now your external auditory meatus is where sound waves come into your ear. Okay, the internal auditory meatus is not where sound waves go, but this is how your nerves connect your brain to your inner ear. Okay, so the nerve runs through this, okay, as it connects from your brain to your inner ear. We'll talk about that later on in the semester when we talk about ears. Okay. Other structures I want to talk about include the two carotid canals or foramina, and what we call the jugular foramina. Okay, the carotid canals, you can see, are labeled here very nicely. I'm going to darken them in. These are two holes, one on each side, that allow for blood to travel up by way of what's called the internal carotid artery to feed our brain. Okay. So obviously very, very important. This is how our blood is able to travel into the cranial cavity to feed the brain. And then once that blood has fed the brain, it needs to come back down, and it's going to do so by way of what we call the jugular foramina. Now, they're not labeled. I'm going to darken them in, but I'm not going to actually worry about knowing them, since it's just kind of hard to see. Okay, these two little tiny holes right there and there are the two jugular foramina. Okay, they allow for what's called the internal jugular vein, the blood vessel that drains blood after it's fed your brain, to come back down and go back to your heart. Any questions here? All right, let's talk now about some singular bones. We'll start with the occipital, which in my opinion is the simpler of the two, although it's got a lot more structures to know. And then the sphenoid bone, which is one of the wildest bones in my opinion. Color coding things. We haven't used orange, so let's do that. That's a nice color for occipital. Do orange. And how about pink for the sphenoid? That'll stand out, show up real nicely. Okay, occipital bone is going to form back of your head, and it comes underneath to help cradle the base of the brain. Okay, this will probably be the image along with this one that I kind of refer to the most on it, but I'll go ahead and color the others as well. This is the interior, so it's just like that cranial floor that we're talking about. The same image we were just using a second ago. I didn't really include this image for this bone, but I'm going to go ahead and use it anyway to color it in since it's visible. And then, like I said, this will be the one that we probably use the most, I would say, to identify these structures. And this is that same look at the bottom of the brain, or bottom of the skull, excuse me, with the mandible removed. Okay, we'll color the sphenoid. Let's just run through and identify these structures here first. Okay, the most prominent feature of this bone, shown very nicely here and here, what we call the foramen magnum. Foramen is a term that means whole. We've already seen that. And magnum just means big. So this literally translates just mean big hole. It's not the biggest foramen in the body, but it's one of. And this is what allows the spinal cord and the brain to connect to one another. Okay. On both sides of the foramen magnum, I'll zoom in a little bit here. I'm going to kind of outline them. These kind of kidney bean shaped pads are called occipital condyles. A condyle is just a kind of flattened spot where two bones are going to meet. These two connect to your first vertebrae. So this is where the connection between your head and your neck exists, forming what we call the atlanto-occipital joint. Another very important and prominent feature of this bone, I'll darken it up there, called the external occipital protuberance. That's what this little point is right there. Okay, and I'm just going to abbreviate it, external occipital protuberance. You can feel that very easily. Okay, this is an attachment site for what we call the nuchal ligament, which is what helps hold your head to your neck. Okay, if you feel that little rounded bump on the back of your skull, now you know what that name is. Okay. Now on this bottom image that we've continually used, go ahead and darken them up a little bit. We call these nuchal lines. Okay, there's superior and inferior. Here's the superior. Here's the inferior. These are actually the superiors. These are the inferiors. I'm not even going to worry about highlighting them just because they're so kind of hard to tell, but they're important muscle attachment site for muscles of your neck. Okay. Final structure that you can see down here in this bottom image, another couple of holes. I'm going to darken them in. And it's really kind of a pair of holes between this bone and those two temporal bones that we just talked about, what we call the foramen lacerum. Okay, it's formed anteriorly by the sphenoid and medially by the sphenoid and occipital bones, and it allows passageway stuff that I'm not even going to worry about you knowing. So very similar to those carotid canals that we just talked about. All right, your sphenoid bone. Like I said, it is a very complicated bone. It can be described as the keystone of the cranial floor because it articulates with all of the cranial bones, holding them together. And this is a bone that I like to tell students, think of it like a butterfly. I call it the butterfly bone. And as I color this image here, hopefully that will make you understand why. Kind of looks like a butterfly. In fact, what's neat about it, it actually has wings. Okay, what we call the greater and lesser wings are some of its important structures that I'm not really actually going to highlight or anything like that. Okay, the lesser wings form the posterior margin of the anterior cranial fossa and with the Sharpie bone crest. Okay, and then the greater wings form about half of the middle cranial fossa structures that we talked about earlier. Okay, now it not only forms the floor of our cranial cavity, but we can see it in our lateral view because it contributes to the lateral wall. It's kind of weird in that it comes up like it does. So we can see it from the side. Here in our medial view, we can see some parts of it that I'll talk about here in a second. Kind of weird looking view to show it off. It also contributes to our eye sockets. In fact, it forms the back of our eye sockets. And then we can see a little bit of it from the lateral walls here in our anterior view. And then it actually is visible here. But I'm not even gonna worry about coloring it. It's just kind of hard to illustrate it there. So I'll just worry about these other pictures. Now there's two structures that I want you to know on the sphenoid. Okay, although there's a lot more. Okay, these are only two things I want you to know. Okay, first one is called the sella turcica. Kind of just this region right here. Okay, sella turcica is a term that actually translates to mean Turkish saddle. Here's a real good view of it. Okay, see how it's kind of this cradle right here. Okay, think of it like, you know, if you take your hands like this, what fits in there is a structure called the pituitary gland, a little thing that's like the size of a pea that hangs down from the base of the brain. And so it fits perfectly right in there and it's not going to wiggle around or anything like that. Okay, so that's a big reason why I included this medial section view. This also gives you a really good view, and I'm going to darken it in, of another one of those sinuses. Another one of those cavities within a bone that connects to your nasal cavity. And that's called the sphenoid or sphenoidal sinus. Kind of, if you visualize where this is at, it's almost like dead center in the middle of your skull. You like just go straight back from the middle part of your nose and then meet where that would intersect, just like in where that temple is that I've been referencing, where those two things meet. That would kind of basically be the location of that sphenoid sinus. All right, our next bones, I'm going to talk about a few of them on the same slide, even though the listed ones down there at the bottom are not cranial bones. Inferior nasal concave and the vomer are both facial bones. I'm going to talk about them with our last cranial bone, the ethmoid, because these guys are associated with like the anterior part of your nose. So not, the outside of your nose. And so you don't have the actual nasal bones on this page. We'll get into those on the next slide. But these bones help form like the interior of our nose, okay? Which, as we all have probably become really aware of, thanks to COVID tests where they shove that thing all the way up because like they're tickling your brain, you probably now realize just how complicated and deep in your skull your nose actually goes. Okay. So let's talk about our last cranial bone. I'm going to color it yellow. It'll be a nice one that stands out. Okay. It is called the ethmoid, and it is a sponge-like in appearance anterior cranial bone between the eyes, contributes to the medial wall of our orbit, eye socket, the roof and the walls of the nasal cavity, and the nasal septum. So it's not only associated with your nose, but it's also associated with your eye socket. Okay. Here's its location in our medial view. And our superior view, looking down the floor, you can see not a huge contributor to the cranial floor, but it does contribute nonetheless. And then it is very small and subtle, but it is part of our eye socket. Looks like there's two individual bones here, but it's the same bone. Okay, so it's involved with that. Come on, stop doing that. But we also get a good view of it and what it does for our nose here from the straight on anterior view. It's got these two little hook-like structures that are part of the lateral wall, and then it helps to form the nasal divider, what we call the nasal septum, okay, which we're looking at over here. This, I don't have a picture to color, but this one shows it with the face kind of cut off, so we're looking a little bit more deep. Okay, nasal septum is this wall here. Okay, now the nasal septum, and I'm gonna go ahead and color the final bone that's listed here, is not just contributed by way of the ethmoid, but the vomer as well. It forms the inferior half of the nasal septum. It's our bone here, letter H. And then it's very subtle, so watch as I color it because you don't want to miss it. There is there, and it would be right there. I'm not going to worry about this one for the exam. I just included it so you can kind of visualize some of these things. Together, those two bones help form the nasal septum, which when a person breaks their nose, a lot of times that's actually what's damaged, not their nasal bones, but it's internal nasal damage where that little thin wall, you can see it's not super thick, has been broken. Now, your nasal septum on the outside is made up of cartilage, and that's why like people can get a piercing in it. You think like cartoons, when a bull has the ring in their nose, that would be through their nasal septum. Internally, it's bone, okay? You guys ever heard the phrase deviated septum before? A deviated septum is where that septum is not straight up and down like it hopefully should be, and therefore it's going to affect breathing, and people probably snore a lot that have that condition. Okay, that's what a deviated septum is. Okay. Now there are some kind of craziness structures to our ethmoid bone. Looks like this from the just straight on view. Okay, this is an anterior view of it, kind of giving you a feel for it. Here's the structure that helps to form the nasal septum, what we call the perpendicular plate, which would be what this is here in our median section view. Okay. That's one of the two plates that make up your ethmoid. Okay. The other plate helps to form the roof of the nasal cavity. Okay. You can think of your ethmoid kind of like a T, a lowercase t, where you've got a vertical line and a horizontal line. Okay. The horizontal line is what we call the cribriform plate. Sorry, my finger got smashed. It's not been colored, but it's busted up. Cribriform plate. Okay. This is what I just kind of boxed in right there. And this is really struggling to stay focused. Sorry. Cribriform plate. That forms the roof of your nasal cavity. So if you kind of visualize, and I'm going to take my screen off so I can show you guys. Just kind of, think of a T, okay? Going across your nose, and the vertical line, that's the septum, and then the horizontal line that I'm using right here, that's the roof, okay? So just above the cribriform plate would be the bottom of the brain, okay? Now, we all know our nose is used for the sense of smell, right? Okay. Well, the cribriform plate actually has tiny little holes in it that enable nerves to come down, neurons to come down from the brain and come into the nose so that we can actually transmit the sense of smell up into the brain, okay? Those are called olfactory foramina. I mentioned them up here. I'm not going to worry about talking about them quite yet too much, okay? Now, notice I also kind of colored this thing that looks like a little triangle or a little rhinoceros horn, okay? That structure has a fun name. I don't remember what it means. Well, that's called the Crista Galli. Crista Galli is actually what's labeled over here. Okay. No, sorry, cribriform plate's labeled there. Crista Galli would be visible here. It's just like a little projection. You can see it really nicely here. On both sides of it are two nerves, and those are the nerves that then come down through and into. So it just kind of helps separate those two nerves. Okay. Okay, now, like I mentioned earlier, your ethmoid bone, it looks like a sponge, and it's because it's got these little pockets in it, each of which is called an ethmoidal sinus, okay? Or they're each called ethmoidal cells, the entire structure, I guess, the ethmoidal sinus, okay? And these all connect to your nasal cavity. And this is the set that really bothered me when I get sick. It always feels like somebody's just like pinching right between my eyes. And I got that like vice grip right there. And when I'm sick and those are all plugged up, it's not very wonderful for me, okay? Now, this view also gives you a nice illustration of these hook-like structures. Each of these little hooks is called a nasal conchae, okay? What they enable is, and this is way back into the nose, your nasal cavity becomes kind of compartmentalized. There's these little spaces, little grooves, each of which is called a meatus. And what's nice about them is there's mucus and ciliated cells here that help filter, but also warm and moisten the air that we breathe, okay? Which is important. We don't want cold, dry air hitting our lungs. We all know what that feels like, and how that can really, make you have a sore throat and that kind of stuff, okay? Now, the superior and the middle nasal conchae are part of the ethmoid. So I could color these yellow, but I'm not going to. Over here, we can see the middle. Notice I didn't color the letter N. I believe that's N, because yes, that's letter N. Those are the inferior nasal conchae, and they're separate bones, okay? They are these lateral bumps here. So in other words, if I were to color them here and here. So the superior and the middle are part of the ethmoid, whereas the inferior are separate bones, and that's why they're colored independently. Make sense? So now hopefully you have another appreciation for just how complicated your nose is, if you didn't already. And if you've never had a COVID test, consider yourself very lucky. Imagine everybody has by now, though. Okay, any questions? All right. Now, moving on. What's nice is now we're in the facial bones, and as you just like saw with the inferior nasococci, a lot of them you just have to be able to identify the bone. You don't have parts of them. There's a couple here that you do have to know a few things, but for several of these, it's just identifying the bone. So that hopefully will make it a lot easier for you. All right, gonna go yellow for the maxilla, pink for the palatines, baby blue for zygomatics, orange for the lacrimals, and purple for the nasals. All right, I'm actually gonna start at the bottom because I'm gonna get the easy ones knocked out first. Okay. First bones are the nasal bones, just forming kind of the bridge of your nose. Okay, the rectangular in shape, nothing really crazy going on there. Okay. Pretty hopefully straightforward. Okay. Your lacrimal bones, two very tiny eye socket bones. Unlike the ethmoid, letter E there that we just colored. These are individual bones, so it's not the same bone connected. What you see here is all you got, okay? They do actually have one special feature. I'm gonna darken it up here. It says fossa 4 lacrimal sac. I usually call it lacrimal fossa. So just know that's this lacrimal fossa. It's an indentation, and it's where the lacrimal sac sits. This sac is where our tears collect if they don't run down our cheek. And then from there, tears, if you didn't know, actually run into your nasal cavity. And that explains why, if you never knew, when you cry a lot, what happens to your nose? It runs. You're literally crying into your nose. Okay. It's weird. It's a flushing mechanism. It helps clean things out, which is why we don't just cry like when we're sad. We cry like if we have like something in our eyes or in our nose, or we're experiencing allergies. Okay, zygomatics, letter J. Very principal cheek bones. Also contribute to kind of the lateral and a little bit of the inferior section of our eye sockets. Now we've seen this term zygomatic already, because as we just learned, your temporal bone has a zygomatic process. Okay. Well, your zygomatic bone right here, where this little triangular notch is, that's called a temporal process. And so it's super backwards. I wish they were named zygomatic process on the zygomatic bone, temporal process on the temporal bone, but it's the flip. It's reverse. It would be too easy, absolutely. But together those make what we call the zygomatic arch, okay? Which is visible here. I'm not going to color it, but there's a little space right there, and that's where that muscle that I had to feel for earlier connects, okay? All right, your next bones, palatines, they are very associated with the roof of your mouth, which is why we've got this bottom image on here, where we're looking at the roof of your mouth. Now, the roof of your mouth, there's kind of two parts, the hard palate and then the soft palate. Okay, the soft palate is made up of muscle, and that's like at the back to help you swallow. Hard palate is made up of these 4 bones. 2 palatines. Actually, we can see them here. And then your palatines, they're kind of wild in that they also come up, and it's very small. But look at letter K here. Just a little itty bitty part. Obviously, you couldn't probably do this on the exam, but I wanted to color them anyway. They contribute to your eye sockets. So not only do they help form the roof of your mouth, but they contribute to your eye sockets. The other part of our hard palate, and a much more prominent part of our hard palate, comes by way of our final bones. The first one's listed there. Call our maxilla or maxillary bones. Okay. really just wanted to show kind of how it helps form the roof of the mouth for these two bottom pictures. The top two images really where you can see stuff. Okay, associated with your maxillary bones or maxillae include a couple holes, what we call the infraorbital foramen is the name of each, not to be confused with the supra. We said supra was short for superior. What does infra going to be short for? Inferior. Okay. What you can't see in any of these images, and that's okay, but your maxillary bones have spaces in them called maxillary sinuses, large cavities. Basically, they're kind of just like right here, where kind of my fingernails are. So those are another set of sinuses that connect to our nasal cavity, and therefore they can get plugged up and get infected. Okay. Last thing I want to talk about associated with your maxillary bones, we're going to talk about them again on our next bone. We won't get to that today, but these have our teeth associated with them. Okay. And our teeth are supported. I'm not going to just draw a line across like this little ridge coming across. That is called the alveolar process. So each of our maxillae have what's called an alveolar process. Not to be confused with what's listed up here as alveoli, which are the sockets. Sockets that our teeth insert into. And these were like when we have baby teeth still in, that's where the adult permanent teeth are. They're still stuck in those sockets, but then they come down and then the root of your tooth is still connected into them. Okay. You can't see those because we've got the teeth inserted, but just know like the little pockets where your teeth are would be what we call an alveolus. Alveoli is plural and alveolus is singular. All right, we'll stop here. We're almost out of time and that's okay. We've got just one more facial bone to talk about, and that will be on the mandible. So we'll start with that fresh on Tuesday. That's okay. We'll just stop. So we'll start with the mandible Tuesday. All right. Have a good rest of your day.